Thank you, Mr. Chair, Vice Chairs. As a constituent of District 51, I wanted to share a professional outlook for myself as well as a personal outlook. As a healthcare professional, we are tasked with providing care to those who need it. When we step forward, we promise that we would apply our knowledge to our patients as a whole and not simply attempt to fix something based on our personal beliefs. And that we'll not use our skills in any enterprise that is detrimental to the well-being of the individual, the communities that we serve, and the general public. We seek to treat illnesses, injuries, and disorders within the boundaries of ethical standards and within our practice. Homosexuality was removed from the Diagnostic and Statistical Manual of Mental Disorders in 1973. Transgender and gender nonconforming identities were removed from the DSM also in 2012. Over the past 40 years, research has consistently shown that the issues pertaining to mental health of LGBTQ individuals stem from their social environment and not from sexual orientation or gender identity. Conversion therapy has been wholly rejected by just about every reputable body of professional providers as well as organizations which shape the medical landscape in this country in terms of what those standards are acceptable, what standards are acceptable. The list of those groups are numerous. All of those groups have taken positions, released findings that conversion therapy causes significant harm to patients and places them in an increased risk of suicide, mental health issues, and self-destructive behaviors. And armed with that knowledge, we must consider that conversion therapy is a solution where there is no problem, and it is a treatment for a disorder or illness that does not exist. From a personal standpoint, on October 22nd of 2003, I lost somebody who was very close to me, not because he directly went through conversion therapy, but because his family treated him in a manner that conversion therapy treats their patients. So in 2003, a person I cared for very much committed suicide, and that has stuck with me for the past 13 years. It will never, never, ever leave my thoughts. So I act on behalf of Frank to do what we could not do back then for children, that what we can do today. So I ask that we please vote yes and protect children in our vulnerable communities from medical overreach based on science that's not there.
Thanks. That's 2 minutes.
Thank you very much for your testimony.